Or to any of them, please feel free to speak out. Yes.
Dr. Jackson, can you talk about what kind of direction you've given the local health departments on distribution of Tamiflu? And is it just Tamiflu, or did you send Tamiflu and influenza?
Okay, good. We made a decision to send out the antivirals early, as stated, so that if there are some particular challenges when we are doing the distribution of the vaccine, that it won't be any problems there. We are in contact with all of the local health departments. We have weekly calls. We talk to them every Wednesday, and then we have a specific call on Fridays which address the particulars of H1N1. And so we have addressed all of those specific questions there. And do we, Mr. Wagner,
yes, sir.
as far as the Tamiflu, I know about that, did we send out the relenza as well?
That's right, relenza and PE, the personal protective equipment.
Yes, and so that. And Mr. Steve Wagner is Director of Preparedness at the Ohio Department of Health. Since 2001, the nation, in terms of preparing from the unpredictable, meaning most health departments created this division to address issues as pandemics, floods, etc. Mr. Wagner has that department and also is responsible for all of the structural issues associated with the virus, and also Ms. Barker as well.
Doctor, when the governor mentioned the stockpile, is that, how long have you had that? Is that for this strain? And how quickly will it be distributed?
The Strategic National Stockpile, when we first heard about in April 2009, H1N1, 25% of the federal allotment to the state of Ohio came to us. And we had those antivirals. Also, the state of Ohio had already purchased about $18 million for antivirals as well. So we've had those antivirals, and really early in this pandemic, we did send them out to some of our regional sites, but brought them back. And now we are sending them out again for the fall.
How do you envision the local public health agencies, eventually when we get to the part of the public is going to be able to get the H1N1 vaccine itself, how do you envision that's going to be distributed? Through hospitals, through local MDs, through care centers, line up at the door, or how do you do that?
Are you talking about the antivirals, or are you talking about the vaccines?
The vaccine itself.
In terms of the vaccines, the Ohio Department of Health asks providers to register at our website or our impact system so that we can know who the providers are in the community. The vaccines themselves would go directly from McKesson's to the providers for local distribution.
I'm sorry, could you explain, like, when you say antiviral, is that the nasal spray or is it a vaccine, and how many doses are you
Okay, let's talk a little bit about the vaccine and the antivirals. The antivirals are the medications, relenza, Tamiflu, Flumis. Those would be the antivirals. The vaccine, H1N1, is what's coming out very soon to us, which would be either the Flumis form or the injectable that we will be giving soon. So the antivirals are medications. And did you want to make a comment?
I was just going to give a local perspective on the question relative to distribution of the vaccine. In Hamilton County Public Health, we have established 100 points of dispensing sites with our parochial, public, and private schools. We're clearly targeting the school-age children. We have engaged our OB-GYN Society and are asking them to obviously take care of the pregnant women, and we're looking to the hospitals to vaccinate mothers who have just given birth in the hospital, because there will be caregivers of these children under 6 months of age. we also have engaged our Pediatric Society. Now, as Dr. Jackson was saying, providers have been signing up on the Ohio Department of Health website in order to receive vaccine. In Hamilton County, we have now about 350 providers that have signed up and saying they will participate in the vaccine administration program for H1N1.
And the fact is free.
Well, yeah, a lot of people have, I should never assume, we understand that, but sometimes we do. The vaccine is free. The vaccine is free. Now, providers and others can charge an administration fee in accordance with certain guidelines, but they cannot charge for the vaccine.
And it's very modest.
Yes. So the vaccine is free, and I actually had that question the other night from the Greater Cincinnati OB-GYN Society. I presumed they knew that and realized that I had obviously made an error in that
So
regard.
Kroger's charging $29 for the shot, then giving the shot, not the traditional, not bringing over the vaccine.
Well, no, you will have to pay for the seasonal flu shot.
Talking about H1N1.
Yes.
Are
How
there
much-
limits on
Sorry.
it? Sorry.
How much demand has there been for the seasonal flu shot? Are you seeing more of a demand for that this year? And could you address some reports that there have been some shortages in parts of the state?
There appears to be some increased demand for a seasonal flu shot. That's good news because, as we said earlier, 36,000 Americans die each year from influenza. What we know in terms of the supply from the Center for Disease Control, that is roughly the same as last year in terms of what we got in, so we do not anticipate a shortage. We anticipate having the same amount.
I had a question about priority groups.
Well, the flu mist that is coming in is not enough for everyone. It's certainly going to be on a first come, first served basis, but at the end of the day, there will be enough for everyone. It will come in on a weekly basis. It will come in every week. And as far as the vaccine, we're expecting it within weeks, within a week or so.
One of the things we know traditionally is that when people, despite you're telling people to stay home and they get sick, we know